Are bilingual children more likely to stutter? During the preschool years, approximately 5% to 11% of children begin to stutter. Stuttering is the most common childhood language disfluency. Stuttering often starts around a child's third birthday when there is a great growth in language production abilities. For many children, stuttering is experienced for a short period of time, as approximately 88% to 91% of children will recover from stuttering spontaneously. Researchers have identified various factors that predispose children to be at risk for stuttering onset and persistence. Specifically, the age of onset for stuttering is among the most prevalent risk factors for persistent stuttering. That is, children who start to stutter before age 3.5 are more likely to outgrow it compared to children who experience the onset of stuttering at a later age. Empirical evidence also suggests that males are at a greater risk for persistent stuttering. Family history of stuttering also appears to increase the likelihood of development. More recently, researchers have suggested that being bilingual may potentially increase the likelihood of the development of stuttering. However, this suggestion has been discounted by the data that indicate bilingual children who do not stutter produce an atypically high number of speech disfluencies. Thus, bilingual children are not at an increased risk for the development of stuttering, but they do appear to be at an increased risk for a false positive diagnosis of stuttering. So, do speech-language pathologists believe bilingualism is a risk for stuttering? This video will present the findings from a study whose primary purpose was to investigate practicing clinicians' perception of bilingualism as a risk factor for the development and persistence of stuttering. A secondary purpose of the study was to assess the factors that contribute to one's knowledge regarding the relationship between bilingualism and stuttering. Data was obtained from a total of 207 participants. Participants were from at least 30 different states across the United States. Of the participants, 89%, 185 participants, reported having a master's degree, and the remaining 22 participants reported having a doctoral degree. The results showed that 79.71%, 165 participants, correctly indicated that bilingualism was not a risk factor for stuttering. However, the remaining 20.28%, 42 participants, incorrectly reported that bilingualism was a risk factor for either the onset of stuttering, the persistence of stuttering, or both. So why are some speech-language pathologists more likely to incorrectly believe that bilingualism is a risk factor for stuttering? Clinical experience with fluency disorders plays a major role in the knowledge and understanding of valid contributing factors influencing the development and maintenance of stuttering. Respondents who perceived bilingualism as a risk had less average years of clinical experience when compared to participants who did not. However, some clinicians, despite having many years of practice, still perceived bilingualism to be a risk factor. Across the responses provided regarding what factor influenced their perception of bilingualism as an increased risk for stuttering onset and persistence, personal perspective was the highest response. Personal perspective can be influenced by experiences that may not necessarily be based on evidence or factual information regarding bilingualism and stuttering. These findings support the notion of educating and training clinicians to use empirical sources as their primary reference, as opposed to personal perspective when assessing and treating fluency and fluency disorders. Findings from this study indicate that there are indeed even speech-language pathologists who misperceive bilingualism as a risk factor for stuttering, but the large majority surveyed do not. Although the study is preliminary in nature, it is clear that one's depth of clinical experience and personal perspectives greatly contribute to this misperception.